You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. He is Michigan's go-to implant dentist, board certified oral surgeon. We've had him on the program before, Dr. Mark Jesin. Welcome to the program.
Thank you, Randy. Excited to be here again.
So we've talked a little bit off camera. I mean, you believe nobody should be wearing a loose-fitting denture.
Absolutely. I honestly think that people deserve better than that. Technology has advanced incredible amounts. And, with dental implants, you can get implants in same day and walk out with screwed in teeth. You just don't need to be wearing a denture anymore.
Okay, good. Now you have a stack of photos. We're going to try to get to as many of those as possible.
Yes.
Now we talked on the phone because 5 years ago you were on the program. What's changed?
Well, a lot has changed. Technology has advanced. AI is now involved in designing teeth. But if I had to, yeah, it's incredible. But if I had to say the greatest thing that has changed is my appreciation for how this changes people's lives. Since the last time I was here, I've probably done about 1,000 cases. And over again, I'm shocked about how it changes for people. You take somebody who can't eat or chew, and now they can, or somebody who doesn't smile, doesn't laugh, can't kiss their significant other, or somebody who doesn't go out anymore. They become reclusive. They hide from the public. They don't go to the restaurants.
That's what they tell you.
Absolutely. And now they can do all that, and it's very powerful. It's a profound change in their life, and it's a new chapter. They almost look at their old life. They'll look at photos from a vacation and say, that was the vacation. I couldn't go to that restaurant and eat the lobster. I couldn't order. Or that was the photo. I remember I didn't smile in that photo. I held back. And it's just, they look at their life as before teeth and after their reconstruction.
Now, a lot of people have known about you. I've interviewed you for many years on TV, where you say that they've watched you for 5 years, put it off and put it off.
Yeah, it's a big step. If you're already in a denture or you have bad teeth, you probably have had many dental experiences that have brought on so much anxiety. You've had root canals that have failed, broken teeth, infected teeth. You've had painful, anxiety-provoking experiences. So to bring somebody back into the dentist and to trust us and to, find the team that's trustworthy, that's a big ask for people. So they'll sometimes watch the show for a couple years, two times, 3 years, and then they make that choice. They make that big step to come in and meet with our team, which is huge.
Do they say, Doc, you've changed my life?
All the time. Every single time I hear that. And I look back and I say, you know what? You actually changed your life. You made the decision to come into us, to meet with me.
Okay.
For us to talk about, to see what solutions we can help you with. And you made that choice. We were just part of that process, helped you. And now you're back. You're using that smile to do all the things that you want to do, to change your life, to get the better job, to interact with your friends and do your hobbies again, to go out and be with your grandchildren. You're doing it.
Now, you say all of those patients, those photos that you're about to show us. We'll get, again, through as many of those as possible. But they all have regrets. What do you mean?
I would say I've told you this before. The biggest regret that we hear is that they didn't do it sooner, over and over again, because they missed out on years of doing the things, doing their hobbies, going to the lake house and going and doing water sports.
So people are that self-conscious?
Absolutely.
That they will not do those things?
Yeah. Do you know how many patients walk in with a mask? We're years after COVID, and they still walk in with a mask. Right? They use that as a crutch, or they grow facial hair and a beard to help hide it. Whatever they can do to hide it, or put their hand over their mouth whenever they smile, whatever they can do to hide the shame that they're feeling because of their teeth.
So 5 years. What's changed the most in technology? You say it's much better now.
Well, one of the greatest parts is the digital aspects. Everything is designed, computer manufactured. Everything is 3D printed, milling. So our materials are precise. Our teeth are beautiful, the aesthetics of it. Then artificial intelligence has come in to help us in designing the teeth so they match with the framework of your face. We have the computer helping the artistic sides of our, the human in us. And then there's the technology, the better implants. So if you're missing bone and you've been told you don't have enough bone to place implants, we have specialized implants now, zygomatic implants, to help patients who don't have bone get same-day implants and walk out with a same-day smile.
But isn't it true, though, if you've been wearing a denture like 10, 15 years, you can't do this? You don't have enough bone?
Absolutely not.
No,
it might be true. They might have gone to a different office, and maybe with that provider and that office with their technology and their training training and expertise, they might not have enough bone and they're turned away. But with our training, our expertise, I've gone all over the world. I've flown to Brazil, to Europe, all over the States.
To learn this?
To learn from
Is
pioneers.
there that much to it?
Absolutely. From pioneers to help me learn how, just even small little things from this expert on how to have the most complex cases and be able to still fix them and get them same day screwed in teeth. Especially patients who have had a lot of periodontal disease, they've had a lot of bone loss, they've been to some periodontists, other oral surgeons. I get referrals from other oral surgeons in town and across the state because I'm known as the go-to person in these complex cases. If you've been told elsewhere that you don't have enough bone, call us because
but what if you have bad gums? But if you have bad gums, like this gum disease, aren't your gums too bad to hold the implants?
Not at all, because the first step in the process, let's say we take out the teeth, we disinfect and clean everything. We clean out the gums. So all of that periodontal disease is disinfected and cleaned out before the implants even go in.
So the gums are healthy?
They're healthy. We make them healthy so they can accept these implants.
You brought photos. What are we looking at?
Oh yeah, I'm excited to show you this. So take a look at this first patient. This is Jake. So Jake, I literally did this surgery last week. So right before coming here, he came for his 1 week post-op visit. I snapped a photo. I was like, I have to show Randy this. Okay. He had periodontal disease, bone loss, bad breath. He was ashamed of it. He was heading towards a denture because he thought that was his only option. We did 6 implants on top. Teeth came out, 6 implants on top, 6 implants on the bottom, and he walked out with that beautiful smile that you see.
And they get a full arch of teeth on those 6 implants.
Exactly. And let me tell you what he told me. He said, I've had barely any pain, any swelling. On the day after surgery, I walked in, I had to go pick up something from Costco. The day after surgery, he went to Costco.
Okay.
He rounds the corner in the frozen aisle, and he sees a beautiful baby with big blue eyes, with this toothless, gummy smile smiling at him. And for the first moment in his life, normally he would cover up his smile. He wouldn't smile back at a baby.
Okay.
And he just let it out. He let out this full smile right back at the baby. And he said, Dr. Jesin, that was one of the best moments of my life. It was a powerful moment for me. And Randy, when you look at him and you look at the before and after, it's terrible, but we judge people when they have bad teeth. And I don't like to say it, but it's society that it's like that. But look at him afterwards. Would you say he's more handsome?
Yes.
Does he look more youthful, more alive and happy and vibrant? This is what dental implants can do for people. They can literally be life-changing for you.
Now, correct me if I'm wrong. The way dental implants are typically done is you go to one doctor's office that does the implants, and then a second office where they put the teeth on top. I guess you do both parts.
So
is that why you do it so quickly?
Well, we do it really quickly, because we have our own in-house lab. So I do the surgery, we place the temporary teeth, and we work with our in-house lab. We're not working with a third-party lab from China or wherever. We design, we make the teeth, we put all the artistry in it. And if you have a general dentist that you love, we work together with them as a team to perfect your smile.
So in your area, you work with they don't even have to switch a dentist if they love their
Not
dentist.
at all. We love working. We work together as a team to give you the best results.
Okay, and you literally print teeth, make the teeth right there on
3D printed, same day. You walk in with your bad set of teeth or your missing teeth, and you walk out same day with 3D printed teeth that don't come in and out.
Now, what are the categories? I guess there's the denture wearer, and then there's a person with really bad teeth and gums.
Yeah, there's 2 basic types of patients. One is the patient who's already in a denture. They're suffering. They hate the goop, the adhesive, the gagging, maybe the choking on food, and the inability to taste their food. And they want something different, and we have that solution. And then there's the other patient who's heading towards denture. Maybe they're missing 3, 4, 5 teeth. They have broken teeth, infections, loose teeth, bad breath, and they know that they're heading in that direction, and they want nothing to do with it. And they want a solution. They want teeth that don't come in and out. They want a brand new smile. They want a fresh start again.
What do they like more after it's all done? How it looks or what they can eat?
It's funny. Some people, they're all about the function. They come in, I don't care how it looks. I want to be able to eat a steak. I want to be able to eat that pizza, chew into it. And then they start to get a compliment or two. They're walking about and they're like, hey, I love how this feels. I love it. They're taking selfies. They're posting to Instagram. And then you have the people that really want to look good. They're tired of being ashamed of their smile. But in the end, whether it's the function or the chewing, it doesn't matter. It's all about changing their life and what they do beyond that and how it affects their employment and their careers and their ability.
How so?
You know, I
does
have
it affect
patients,
their
I'm going to
career?
show you patients who work in the public. They work at trade shows. Can you imagine being with bad teeth and being in the public and interacting and trying to sell things at a trade show and having to also be intimidated and ashamed of your smile? Can you imagine how you can advance in your career if you're able to be confident and put yourself out there and be vibrant and jovial and happy all the time and not have to hold yourself back? It's life-changing.
It's big.
It is big
Okay, let's
stuff.
take a look at another photo.
Yeah, let me tell you about Ruthie here.
Okay.
So Ruthie was in a denture. She told me she had lost 40 pounds. Ruthie is a hilarious woman. I love her. She comes in and she says, Dr. Jesin, I'm too young and too cute to be without teeth. And I said, Ruthie, you know what? You've come to the right place. And we're going to just fix this part, but I can tell you have the personality. And just by fixing your smile, you're going to light up and be the person. She loves to dance. She loves to go out to eat. She loves salads.
What was going on before, in that before photo?
In that before photo, she's in a denture. She's in loose-fitting dentures that don't fit her, and she can't, therefore, it's holding her back from doing the things. Because if she's out and about with her friends, they can flop around. People know that she's missing teeth. She's embarrassed by it. And so now when we did this procedure, same day smile, same day implants, and she looked at herself in the mirror, I remember her crying and saying,
right?
It's me, it's really me. And what I noticed in that moment is that a part of yourself, you lose a part of yourself when you miss your teeth. And she felt it immediately coming back as soon as she looked into that mirror. She knew that she was going to be back there again. And look at her, Randy. How doesn't she look dramatically younger in that photo?
In the after, yeah, she does look younger.
And I love it because she was saying, look at it. I call her, I joke with her, you know, you are cute. You are youthful. I'm so happy we were able to be part of that and bringing that personality back that she loves to show to the world. So take a look at these two.
Okay.
You've asked me before, have we done family members? We've done it all. We've done husband and wives. We've done mother and daughter. And I love this couple because we did Kurt first. He came to us. He was the guy I was telling you. He works in trade shows. He's in business. He's always in front of people. He can talk about anything. And he needed a beautiful set of teeth to be able to feel confident. And we gave that to him. And then a few years later, he comes and he says, my wife, you know, she's struggling with the snap-ins. I've told you before. I don't
Snap-in dentures.
The snap-in on implants. And
you don't like those?
I don't, because the patients don't like them. I like happy patients. I love patients that are completely satisfied with the results. And here's a case in point, is she had snap-ins somewhere else. She's already had 3 broken dentures because it's just plastic, the snap-ins. She's had 2 implants fall out. And she can't eat and chew, and she can't be out there. She's at the trade shows with him, helping him.
So what did you do for her?
So we gave her a brand new set of teeth that don't come in and out. And look at how gorgeous she is. Would you say she's more attractive?
Yes.
Like absolutely stunning.
But that's everyone you say.
Everybody I say, but I tell, you know, Kurt likes to ask me, you know, who looks better after the dental implants? And I tell him, Kurt, you have no chance. You know, it's all Jackie. She's got you covered.
Do they walk in differently? I think you told me that. Like after it's all done, do you like pick up on their enthusiasm or confidence or charisma?
You know, they're like family. I feel it. I feel it, the difference immediately at the post-op visits. They come in with more confidence. You can see it in their walk. You can see it in the way they present themselves. Even when they come to the front reception desk, the way they interact with our reception, right at that moment, you can tell the difference. You know, they're a couple and they're going to love to travel together. And you can imagine they're going to want to taste the local food, enjoy restaurants. And if they were in dentures, they wouldn't be able to do it. All that plastic covering your taste buds and your roof of your mouth. And this is truly going to be life-changing for them in so many ways.
If somebody's watching this, either they have really bad teeth and gums or they're wearing a denture. If you had an opening in your schedule, next week they could have their teeth.
Absolutely, because we have that 1, 2, 3 step process.
What is it?
You come in for a consultation. 1, you meet us. We go over your options. We check if you're a candidate. And we also go over financing options so we can figure out the right monthly budget to make it work for you. And then number 2 is the fun part, smile design. We get to prep for the surgery and plan it all out. And then number 3 is the big smile transformation day. You come in and you wake up with that brand new smile. And I like to say there's a step 4. When you go out around town and you're smiling and you're taking the selfies and you're going out to the restaurants and eating whatever you want and you're really living your life the way you want it.
When you're on a consult and you're hearing their hard luck story, do you ever get excited? And you know they're going to move forward with it. Do you ever get excited, like thinking, they don't even know how good this is going to be?
Absolutely, because I can see the future.
Okay, okay.
I mean it like I look at the picture frame. They have everything there, but they're missing the teeth, this part, the smile. And the smile is the window to the face. It is the centerpiece. And so if we can fix that, it just changes so much about them. And so that's why I want to be there, because I can see where they're going to go and what's going to happen to them, because I see it day in, day out with my patients.
Now, you're an oral surgeon, right? I guess the person with the training to handle these type of procedures. And it doesn't cost more to go to somebody like you.
Not at all, because
it's about the same wherever you go.
Absolutely, but what's important is that you get it right the first time.
Okay.
That you come to expertise, because especially if you have a tough, complicated case, maybe you don't have as much bone as others. If you go to a place that doesn't have the expertise to place it in exactly the right positions where you have the bone and to do it the proper way, you can spend thousands of dollars. Sometimes other places, maybe they don't have the training to do it without the bone grafting. So they put you through 6 months, 8 months of bone grafting and healing and a denture, and you're paying
So that's not necessary anymore?
Yeah, some people are paying $5,000, $8,000 just for bone grafting. They haven't even started with an implant. So if you come to people that have the expertise to do this the right way, it can actually be less costly in the end. Take a look at David over here.
Okay.
David was suffering with periodontal disease. Look at those. You can see those teeth are flared out in the front.
That's got to be unusual.
It's not unusual because you just don't see it. They hold back. They don't smile. They've learned to hide it. They hide it from the public so you can't see what they're dealing with. And you think that they're angry, that they're secretive and upset at all the time.
Okay.
You think they have, something wrong with their personality. But it's not like that. They're just struggling with a problem. They're dental problems. And look at what we did for David. You can see
Looks good.
We gave him this brand new smile. And look at how he feels now. Everything is changing about him. He's dyeing his hair. He's now without glasses, wearing contact lenses because he feels more youthful. He feels younger. He looks like he's physically fit. He's taking care of himself. And this is what we see over and over again. You start with the teeth and everything else just comes in a domino effect, better and better in your life.
Now, most of these patients, you say, do a lot of research before they get to you.
Of course, they look on Google, they look at online reviews, they look at, implant sites, and they try to figure out who is the best person to trust for it.
You have a lot of reviews?
Absolutely. Let me show you Dorothy. Very special to me. She's my aunt.
All right.
This is how much I believe in this treatment. I'm doing it on my own family. Dorothy was suffering with a partial. She was missing back teeth, a partial denture that comes in and out. She never liked it. She was also having decay around her crowns there on her other teeth. And she was never happy with her dental situation. She was always
tough time eating?
Tough time eating and also ashamed of it. She never loved her smile. And she always told me, I'm going to do this at some point. And we finally did it. I finally got her to do it.
Would she have ended up in a denture if she didn't?
Absolutely, with all that decay going on under the crown.
An oral surgeon?
Exactly, and I was not going to let that happen. We gave her upper and lower a brand new smile, and look at her. She is 80 years old, and she is now taking care of herself.
She's 80 right there?
Absolutely, exercising. She's lost weight. She's eating healthier. She just feels overall great. And you know what she tells me?
What?
I see her every couple weeks, and there's not a visit that goes by where she doesn't pull me aside, whisper into my ear, you gave me the greatest gift that anybody has ever given to me in my life. And if she wasn't my aunt, she'd probably go on that process, that merry-go-round of going to the root canal specialist and then another broken tooth and extraction and never being satisfied with her dental care, never being satisfied and reaching the point of being proud of her smile. And I'm so happy I was able to help her with that.
If you're 80, how old can you be to do this?
I've done it in the last month. I've done 2 90-year-olds, one 93 and one 95.
Why would a 90-plus-year-old want to do this?
Because think about this, Randy. If you're lucky enough to reach that beautiful age of 90, what is it that you want to be able to do? What do you enjoy? You want to be with your friends. You want people to come over, bring you food, and be able to eat, chew a pizza, a salad, and a steak, and be and connect with people through eating.
So they're not more likely to fall out if you're 90-plus years old?
Not at all. If you're healthy enough to come into our office, you're likely healthy enough to have this procedure done. And so when I have a 75-year-old ask me, am I too old to have this done? I'm like, you're not even close. Yeah.
Time for a few more.
Let me show you Antonio.
Okay.
So Antonio was one of these patients who was using his facial hair. He was growing his beard and his mustache to hide what he was ashamed of. Look at him. He's missing teeth. He's got broken teeth. He's heading towards a denture. His option might have been told by somewhere else, a denture. That's what you're going to get. We didn't do that. We gave him implants, brand new smile, teeth
Wow.
that don't come in and out. Look at him. He looks like a celebrity, right? Like a handsome, he could be in a leading role in a movie.
So he trimmed his beard.
Trimmed his beard, his daughters, he promised his daughters, and he followed through. Let me show you someone else. Can I show you this?
Yeah.
This is Pam. Pam actually had snap-in dentures done somewhere else, okay? She had 8 implants, 4 on top, 4 on the bottom with snap-ins, okay? All of the implants failed except one, and the other one was on its way out. She was in a very compromised state. She had been to other offices that told her, you don't have enough bone to have implants anymore. So she came to see us, and we're like, you have enough bone. We just have to use specialized implants for you, the zygomatic implants. And she, again, just like everyone else, got same-day implants, same-day smile. She walked out with that beautiful smile.
It looks good. So the way they look like natural teeth, this is computer design, part with your design. Tell me how that works.
Yeah, it's all designed to match with the framework of the face, the curvature of the smile, that it matches the lower lip. There's all these different artistic touches that we make to make it fit in naturally there. So it doesn't look fake. It doesn't look like you walk around town and people might ask you, did you get your hair done? Did something change about you? But they don't know necessarily it was your teeth that you had done. So this is Anthony. He's a youth counselor, and he works with troubled youth who are facing challenging times, and he's helping them realize, he's helping instill in them that they can have second chances and live a better life. And here he is trying to be that role model, and he's holding himself back because he's got broken teeth, bad gums, his gums are overgrowing from the infections, as you can see here, and he's heading towards a denture, and he's ashamed of it. And we're able to give him same-day implants, same-day teeth, and now he can be the role model that he desires. He can beam positivity, come there with the kids and show them what a second chance is about. You can get a second chance with your teeth, and you can get a second chance in life.
And when it's all healed up, I mean, they could bite into like a raw carrot with their front teeth or corn on the cob. I mean, are there limitations?
I literally have patients that say they feel so secure, they feel that they could chew through a door with them. That's how secure they are.
Okay.
Oh, I love this patient. You got to take a look at Heather here.
Wow.
Young mom, struggling with bacterial infection, decay, having trouble. She's got young kids. She's trying to take care of them, and she's struggling with tooth pain and tooth problems. Can you imagine that? Not being able to do your daily activities because your teeth are
So
infected.
she never smiled because of this?
Didn't smile, held back, ashamed of it. And boy, when I took a look at Heather and I saw what we were going to be able to achieve with her, I got so excited.
You saw it,
like you
saw
I
the
thought
end
right
result.
at the consultation. I was like, we got to do this. It was fun.
Okay.
And look at this after. Take a look. Is it not amazing?
Yeah.
It looks
like some sort of computer animation or something to make it look this perfect.
It's amazing.
I'm not trying to side with you, by the way. People need to know. I mean, I'm just asking the questions, but I think anybody that sees this.
And just imagine what this does for a young woman like her and the trajectory of her life.
What do you mean by that?
What I mean by that is if you get your teeth fixed and you have the confidence now to put yourself out there, imagine what it's going to do for her career, for her relationships, for her connections with people. This puts them on a complete different trajectory of their life. And I love seeing that part and hearing about it from them years later.
Okay, I'm going to rush you because we don't have that much time left, so we're going to have to rush through these photos.
All right, let me show you Roger here. I'm going to tell you his age. He's 79, and he's missing teeth on the top, and he's not happy with them. He can't eat and chew what he wants. He's heading towards a denture there, and we're able to give him a brand new implants. We only do his upper teeth because some people don't need both arches. They don't need both jaws. It's just the top that's bothering him. Look at that after. All we've done on
79-year-old guy?
79, and it's taken years off of him.
That's true.
We haven't done Botox. We haven't done fillers, no facelift. All we've done in this picture is changed his upper teeth. That's it. And look at what it's done for his whole energy, his whole face. It's amazing.
Now, in Michigan, are there that many people with bad teeth? Like if they all figured out how good this was, there's just not enough people to fix their problems?
You know, you don't know how many people are suffering because they learn how to hide it. Whether they are covering it up with facial hair or whether they're barely smiling so they don't show you what's going on. But you don't know how many people are out there either missing their teeth, or suffering with bad teeth and are really struggling.
Now, dental insurance, like Medicare, Medicaid doesn't really cover this at all. But you say some people finance this.
Absolutely. A good majority of our patients finance it because they can find that right monthly budget that works for them. So
you have to have okay credit to get this done, right?
Absolutely. Just like anything with financing, you have to have good credit. And with that, you can get the financing that works for you. All right, let me show you.
We got about 2 minutes left.
Perfect. Let me show you Marek here, okay? He's been married, him and Grace, his wife, they've been married for 50 years. It's going to be 51 in December.
Okay.
And they have a beautiful love story, but they confided in me that they're lacking in their intimacy now because she hasn't been able to kiss him in years because he's afraid that his denture is going to move around and be loose and he's afraid of losing it in her mouth.
Okay.
Okay. We did upper and lower implants, same day teeth, and I'm telling you, she walked into the operatory right after surgery and planted a huge big kiss on him. It is beautiful to see that love story flourish and see how they are in post-op appointments.
And this is routine for you. I mean, you see this every single week in your practice.
We see different stories. Everybody has a different story of what they're struggling with, and I see how they flourish afterwards and what changes for them. That's amazing.
Now, because we're short on time, you fly out here, you knew you were going to have this interview. What haven't we talked about, or what's the main message? Like if you had to say, if I could just get this across.
I just want people to call us and to come in and meet with us because you might have had bad experiences with dentists in the past. You might have terrible anxiety, but we understand what you're going through. My team gets it. We understand the fear, and we're here to walk you through that and guide you and help you along. And just please come in and give us the chance to talk with you. Randy, I know we're in a rush here, but do I have time for two?
Okay, two more. Okay. We'll rush it.
Okay, perfect. Let me show you Tansy here, okay? You're not going to believe this. She has been in a denture since she was 13 years old, grade 7. She had medications that destroyed her teeth, and she's been from office to office to office telling her she doesn't have enough bone. She came into us, and we said, we can do this for you. We have specialized implants, zygomatic implants, and we can get you same day, no bone grafting, no years of building this up. Same day you walk in, we put the implants in, and you walk out with teeth that don't come in and out. All right, one last one, Jeremy. Okay. Look at him. He has a lot of shame, struggling with bad teeth, pain, infections all the time, can't live the life that he wants.
Didn't smile before?
Didn't smile at all. And look at him. Look at that after shot.
Looks good.
Completely natural. It looks like it belongs in his face. And he looks handsome. He looks youthful. And imagine again that trajectory that we talked about, how this is going to change his life.
So his life will end up in a different place.
In a completely better place because of having this done. And that's why I say, come in. Don't waste the years thinking about it. Come in and talk to us and get it done. You're going to love the results, and it's going to be life-changing for you.
Okay, we're out of time. I want to thank you for coming on. But final message, the two groups, they either have a denture or they have really bad teeth and gums. They've heard what you have to say, but for whatever reason, they are afraid. What do you say to them?
Give us a chance and come talk to us. You're going to love our team. We get it. We understand what you're going through, and we're here to help.
So if somebody wants to make an appointment, do they just go online, make an appointment, or call your office?
Anyway, they can call or go online, message us. You go on our website, advancedoralsurgerymi.com, and they can make an appointment.
So no more dentures?
No more dentures.
All right, I want to thank you for coming on. Good stuff.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.